Scenario 1 minute reading time. A middle-aged patient in a road traffic accident suffered a sizable splenic hematoma. Observed for 48 hours, has remained well, but planned by a consultant for further observation. Keep in view possible emergency splenectomy if the hematoma ruptures. The patient wants to be discharged because he has an important interview the next day. The patient is also facing financial difficulties because of his wife's new diagnosis of cancer.
Hello, my name is Andrew McPherson. I am one of the candidates for the MRCS exams. Can I know your name and date of birth, please?
Timothy Green. I was born on June 5th, 1968. That would make me 55 years. I've been around that long, you know.
Thank you. How would you like me to call you during this conversation?
You may call me Tim, but my friends call me Tim the True Green. But I would prefer it if you called me Tim. Thanks for asking, Doc.
Hello, Tim. Before I go any further, I would like to ask if now is a good time to talk.
Please crack on, Doc. Tim the True Green is listening. You asked for my attention, and you can have it for now.
Thanks. Here are a bit more details about myself. I am one of the surgical doctors involved in your care. I am a trauma specialty registrar. I work as part of Mr. Adam Smith's team, who is the head of trauma and the overall consultant responsible for your care. I am seeing you on his behalf. I have been told that you want to leave the hospital, and I would like to discuss this further with you, if that is okay.
I've requested the nurses to speak to the boss, Miss Smith himself, not a deputy. But to be fair to the nurses, they told me Miss Smith was held up operating in a theater to save a young lad's life who had a motorbike accident and is fighting for dear life at the minute. Poor chap, so I accepted that I would speak to a deputy on this occasion. I have mixed feelings about you being here, but I am happy to talk to you anyway. I apologize if I sound rude. I am anxious and agitated at the minute.
Sorry about how you feel, Tim. Most people in the same situation would probably feel the same way too. Regarding leaving the hospital, can I first ask you why?
Staying in hospitals is disappointing and frustrating. I feel sad, helpless, hopeless, and underproductive. I am considering my highly valuable and marketable skill sets. I lose several pounds every day. I stay in the hospital just lying on the bed. Doc, you know of Britain's cost of living crisis, right? If you do, you will appreciate that keeping me in the hospital longer than necessary puts me at an economic disadvantage.
I appreciate all your points, and I agree that staying in hospitals is frustrating and disappointing, but you must know that people are only kept in hospitals when necessary. In your case, this is clinically indicated, and we across Miss Smith's team, including Miss Smith himself, believe it is in your best interest to do so.
This may come across as oversharing, but my wife has cancer, and I must visit her doctor and be there to support the most critical person in my life, if you know what I mean. As you can tell, family is vital to me.
I agree with you on the importance of family, and we are here to support you as much as possible. However, if I can explain your case more, that would be great. You have what we call a splenic hematoma. This means a blood collection around the capsule of your spleen. The spleen is an organ present right here in the upper left side of your tummy due to a rib fracture. I have brought a picture to show you. Due to this problem, your hemoglobin, a measure of how much blood you have, has also dropped by 1 gram. This means a high risk of continued bleeding leading to continuing and severe deterioration and danger to your life exists. Usually, a male adult of your age has around 16 grams, and the rapid drop is unsafe.
Also, I have a job interview, which you will agree would help prevent me from being economically disadvantaged. As I said before, I have a highly marketable skill set in demand in the job market, and keeping me in the hospital puts me at an economic disadvantage.
I understand your situation, and we are here to support you as much as possible. But it would be best if you also looked at your health. If something terrible happens to you, your wife's condition may worsen as there may not be anybody who will look after her as well as you would. I can arrange it with our social workers to find a way to help your wife until your condition improves. We can provide a letter that helps, with rescheduling the job interview if that helps. If that doesn't work, you could search for another job once fully healthy.
I'm afraid, Doc, my mind is made up. I appreciate your advice and concern. But I've decided already. I hope I don't come across as being rude.
Tim, I hear your position. Can you please repeat what we discussed about your condition to know if you understand me well enough?
I understand that my spleen, an organ in my upper left abdomen, is injured and has a collection around it. You called it a hematoma. This hematoma may continue to bleed after I leave the hospital, and I may develop serious complications. I also have made my decision with an understanding of these facts.
Tim, it is not medically safe to discharge you in line with hospital and NHS trust policy. I am afraid you have to sign a legal document called Self-Discharge against medical advice form. Here it is. It covers the exact details of your case, that the continued admission was medically advised, that the potential sequences have been explained, and that you take responsibility for any adverse outcomes.
I will sign that my mind is made up. I have to leave the hospital.
If your condition starts deteriorating, here are some symptoms to look out for. You feel persistent drowsiness, persistent fatigue, or unbearable tummy pain. Note that you may have other symptoms that I have not mentioned, and therefore this is non-exhaustive and does not claim to and should not be taken to be. In that case, I suggest you immediately attend to the accident and emergency department and ask them to contact the general surgical team on call.
Doc, can you please clarify which hospital I am supposed to attend if I feel unwell?
Ms. Tim, you have decided to self-discharge and agreed to sign the appropriate document, so I am going to sum up what we have been through. You know that you have a splenic hematoma, and that the medical advice is to keep you in the hospital. You understand the risks of not being in the hospital, including becoming more unwell and possibly leading to a danger to your life. You have accepted the responsibility for those risks. Also, we have discussed what signs to look for and that you will return to this hospital or the nearest hospital if you are more unwell. If you have any other questions, please ask me. Thank you.
No questions, Doc.
If you no longer have any questions, I will close this consultation. However, if you change your mind before you leave the hospital, don't hesitate to contact me or any team member through the hospital phone number or nurses afterwards. Please remember our discussion and act accordingly. Thanks for speaking to me.